and I'm going to introduce myself. Hi, Miss Smith. My name is Emily. I'm going to be your nurse today. The doctor has ordered a indwelling urinary catheter. That's a tube that goes into your bladder, and it's going to stay there, and it's going to drain all your urine. Okay, do you have any questions? Do you have any allergies? Are you allergic to betadine? Are you allergic to latex? Anything like that you want to ask. Before I do the procedure, it's a sterile procedure, I'm going to do some cleaning of your perineal area just to make sure that we don't introduce any type of bacteria and cause a urinary tract infection. So you want to raise the bed high enough to where you're not bending over and you're comfortable. And then I would also get a trash can. And I'm not a big fan of these, but I get the liner out. And I want to put this next to the bed. That way, whenever I'm doing my sterile procedure, I can just drop things in it if I need to. And then I'm going to perform hand hygiene. Of course, I've checked 2 identifiers, and I'm going to put on a pair of clean gloves. And Ms. Smith, I'm going to expose you briefly to get you all cleaned up.
Did you put those down before gloves?
You could, either way. You're not going to let them check off if you don't. Okay. And then you might want to put a bed bath, a bath blanket or a towel over your patient, or another blanket because they tend to get cold. And you would expose your patient and position them just so. And then you've got your hot soapy water. 1 swipe, 2 swipes, 3 swipes. Oh, you might take a towel and dry them off. Okay, and then I'm done with that. And then in the meantime, I'm going to prepare my sterile field. I want to cover my patient up to provide privacy as much as I can. And I'm going to get my catheter kit ready. You can use this bag as a trash can if you like. You can place it here. You can place it down between the patient's legs. I wouldn't place it over here because you don't want to do too much reaching and stretching once you're sterile. And I'm going to go ahead and expose my patient. Always open away from you first. You don't need that, you can throw that away. Careful that it doesn't flop back. And remember, you can touch that outer inch. Okay, I'm going to use this workspace to put on my sterile gloves. Grab those sterile gloves, put them aside. Grab our drape. Okay, and you can grab the outer inch. Shiny side goes down, and this is what you put underneath your patient. Now, there are 2 ways you can do that. You can put your sterile gloves on and drape your patient, which I'm always scared to do because I'm afraid I'm going to contaminate. So I do it with clean hands and just touch the outer inch, okay? There's another drape in this kit, and it's called a fenestrated drape. That just means it's a drape with a hole in it. I don't ever use it. You can throw it away. Sometimes if I'm catheterizing a male, I might use it. It would go this way, but I'm not going to use it. You don't have to. And then there's a swab stick with distilled water. Looking, is that what that says? Distilled water. I'm not going to touch it. And then, do they both say that?
2 swab sticks with distilled water.
And what's the other one? What's the other package? Sorry, this is different than the kit I've used earlier.
Non-sterile. Non-sterile.
Well, simulated swab sticks.
It doesn't say what it is.
Okay, we're gonna, okay. So those you can clean your patient with. In practice, you would probably see povidone, iodine, betadine, or chlorhexidine. Okay. Then I'm ready to put my gloves on. See how I moved my gloves over to this area of my table? I can see my patient, I can see my sterile field. I'm not gonna overlap, okay? I'm opening these. These gloves don't stretch. Not the best. Okay, at this point then, I don't want to drop my arms below my waist. Pretend you have alligator arms, okay? And that's considered contamination. This I wouldn't touch. Some people will swipe it away with their elbow. You don't want it to fall on the floor and then you slip on it and break your hip later, so I would just leave it on the table. And then arrange this how you would like. I always kind of like to square things away. I'm going to first of all take this sheath off of my catheter. You want to be real careful when you're doing this because you don't want it to flop around and get contaminated. And then you can drop this in the trash. It's probably going to hit the floor because I'm not very good at aim. Put that back in my box. Open up your swab sticks. Make sure I put them where I can reach them easily. Open up your lubricating jelly, which you won't really do. You'll simulate that, okay? You want to lubricate the end of your catheter. Your instructor will spray it for you if you need it. You probably won't even need it. And then you take your syringe with your sterile water and you want to connect it to your catheter. Be careful not to let it flop around. See how hard this can be?
How much time do we have to do this?
25.
Okay.
Okay? Now I'm ready to clean my patient. So I take my non-dominant hand and I spread the labia, okay? You're gonna have to use your thumb and index finger, pinky side of your hand, however you need to do to open up the labia. In the real world, you're not gonna be able to do that. You're gonna have to really get down in there and open up that labia, okay? And then I'm gonna clean. Once I've got my hand on my patient, it never moves, okay? One swipe down the middle. One swipe on one side. One swipe on the other side. Okay, now I'm ready to put in my catheter. You can take this box, you can put it down here. You can just take the catheter and put it down there, okay? It's up to you. And then you grab the tip of your catheter and you can see the urethra pretty easy. Insert, and I may need some lubrication spray. Can you see that back there for me? I had it lubed up earlier, but I guess it dried up.
Okay, I do see that hole right there.
Yeah, that should be good, thank you. On these catheters over on this wall, the hole is much bigger, so you don't even probably need. Okay, till you get a flash of urine, and then keep inserting a couple of inches more. Take this non-dominant hand, hold on to your catheter. And then I can inflate my balloon.
You said till you get a splash of urine, it ain't gonna come out of you.
Yeah, we're not gonna get urine in the mannequins.
Okay, good. Okay, just say it.
And then you can let go. Take your syringe off and then pull slightly. And make sure you grab that because you're gonna need that later, okay? And then you're ready to get your specimen. So I'm gonna take these gloves off. At this point, I would probably clean my patient up a little bit because they're gonna have betadine on them and lubricant, and it's gonna be a mess.
That's with the 10 ml syringe, right?
Yes. Hand hygiene, clean gloves. I'm gonna clamp my catheter so I can get my specimen. So you just kink it and then take this little device and put it over that.
So you can already throw this away.
Yep.
Okay.
And then you open up your 10 ml syringe. And then in the real world, your catheter kits, you have to stick a needle in. We're not going to be sticking needles in that. You have your alcohol swipe, clean with alcohol. You would lure lock your syringe on, pull your urine, and that comes directly out of the bladder. Unlure lock, and then I'm going to take my specimen cup, careful to place it on the table without touching the inside, and then put my urine in my specimen cup without touching the inside of the specimen cup with my syringe. Again, careful not to contaminate. And then I label this with, it's got all the patient's information. Usually they have a sticker. And then you put your initials, date, and time, and how you obtain the specimen, which would be a catheter. And then you want to probably cover your patient up and secure this to the patient's leg. Unclamp. This out of the way. And then this catheter bag goes on the bed frame, not on the side rail. You don't want it on any moving parts, okay? And then you can start throwing away all of your supplies. And then that part of the checkoff is done. You're in good shape. But we want you to take the catheter out. This isn't part of the actual checkoff, but you need to do it because the next person wants to put in the catheter. So you get your 10 ml syringe. You explain the procedure. Ms. Smith, now we're going to take your catheter out. I usually put a Chuck's pad or a towel underneath them because every time you pull one out, it dribbles a little bit and you don't have to change the sheets. Okay. Get your 10 ml syringe. That's got a cap on it so I can lay it on the table. If it doesn't have a cap on it, you would need a new one. I need to empty this catheter bag before I take this catheter out. So you lay a Chuck's down on the floor because you don't want to have a mess on the floor. You get your graduated receptacle. I call it a triangle. Put that down on your Chuck's pad. Take this catheter bag off the frame of the bed. This comes out of this little container, and this is how you would open it. Drain the urine, put that back. You can actually lay it on the bed if you like to at this point. You would take this, measure it, flush it, dispose of that, and then I'm ready to take my catheter out. Remove this from the leg. Now these stat locks, be real careful when you would take this adhesive off the patient. Some patients' skin is very fragile and you don't want to pull skin off. So you want to make sure that you pull at least the 10 milliliters of fluid, the sterile water that you put into the catheter. You want to get all of that out. You may want to disconnect this, shoot that in the trash, and then pull back more to make sure you got all the fluid out. Okay. Okay, Ms. Smith. You're going to remove your catheter. Take a deep breath. Okay. And then this is disposed of in the trash. If you need to provide pericare, then you would provide pericare now. And then if this is a male patient, you would give them a urinal so they can use the urinal if they need to. If it's a female patient, you would instruct them to make sure they call you when they need to urinate, so you can document the time that they urinated after the catheter was removed. And then you would lower the bed, put your side rails up, make sure the call light is within reach, and ask the patient if they need anything. And that's it.